Joining us now this morning, it's Dr. Adam Middleton. Good morning, sir. How are you today?
I'm doing good. Now that this weather is getting cold again, the forecast, there's an article in Dynamic Chiropractic that is an article that talks about pain and weather. And a lot of people, you hear about it all the time, people talking about them forecasting the weather based on their joint pain and arthritic fibromyalgia, some other things like that seem to worsen during those times. And there's actually been some studies done that relate barometric pressure changes that often come in ahead of a front as lowering barometric pressure happens, the external pressures change, and the internal pressures of the fluids of the joint expanding are kind of like taking a balloon and sort of heating up the air inside of it, and the balloon expands. The tissue around that does not expand as quickly as the fluid, so there's stretch happening to some of the pain sensitive tissues around the joint. The important thing that comes to the forefront of this, though, is that some degree of inflammation must already be present. And that's an important thing that I often tell patients, is that if you're predicting the weather with your joints, then there's some problems there, there's some inflammation that may be just a little bit under your radar, but it's already existing, it's already present. And I think that's important because people think if there's no pain, there's no problem. And if the pain's gone, then the problem's gone. But, a very large percentage of problems fly under that radar of the pain signals. And we're only really conscious of about 10% of our nervous system. So the other 90% of the nervous system is flying under the subconscious parts of our brain that we are not aware of. And I think that's a pretty important factor when you hear people saying, "Oh, well, I know my body, and when there's something wrong, I can tell." That's not true. If it were true, we wouldn't be dropping like flies from things like cancer and heart disease and never having known that we even had this. And these things don't happen overnight. They're progressive. They happen over a period of time. But by the time you start to have the symptoms of it, the disease has already progressed. And that's true of most diseases, including joint and nervous system dysfunction.
When people think pain, do they think, long-lasting type of pain? Or is it like maybe they get one sharp pain in one spot one time and they just ignore that, thinking, oh, that's just a one-time thing, and they move on?
Well, and it may be. Pain is a very subjective thing. It really isn't a great determinant on whether or not somebody has a problem. It's actually far down on the list, although it's a great motivator for people to seek care and to start doing something about a problem. If that's what you're waiting for, you're going to be pretty disappointed with your diagnosis and prognosis in most situations. Basically, by the time the pain's there, the disease has already progressed quite a bit, regardless of what the problem is, whether we're talking about arthritis or fibromyalgia, or whether we're talking about cancer or heart disease. These kinds of problems, again, are often asymptomatic for most of the process of the progression of the disease. And so if we're not doing regular checkups, if we're not getting some preventative care in our lifestyle, then we're asking for trouble, waiting for that back to go out where you need adjusted. By that time, it's already, some damage has been done. And usually those underlying subluxations or misalignments of the spine that are causing those serious problems for people have been occurring mild to moderately for a period of time, and could have been taken care of and never gotten to that point. And I think that's true of any disease process. So as we're talking about pain in this article, and we're talking about some things that often we talk about, and people are very aware of that these kinds of things. I mean, all the way back in the 5th century, Hippocrates talked about pain and disease being related to the weather conditions and changes in the weather, and his correlation to that was partially due to those phenomena. And I think, we are looking at the Journal of Spinal Disorders and Techniques concluded that back pain may be aggravated by atmospheric depression in patients with lumbar disc disease. So people who have disc problems and degenerative disc problems and osteoarthritic problems in the spine are often going to notice the changes in the weather due to those problems that they have in the spine. And we're not sure if this is exactly what's going on. There's not enough studies that have really been done to say exactly why, but this is a pretty good theory, and I think this is what I usually have talked about to my patients. We're talking about a body that's internally balanced that needs to adapt to its environment to maintain that balance. And when the external environment changes in drastic ways, well, those internal pressures have to catch up. And some of those tissues are different than others and have reaction times that may be able to react faster or slower than the others. And so what they're discussing here is that the probability that the fluids within the joints are going to expand at a faster rate than the tissues around it. And so that's a pretty good theory. It's not a conclusive theory, but it's a pretty good theory. There's also a variety of other meteorologic factors that have been suggested, and I think temperature, precipitation, humidity, thunderstorms, and increased ionization. I'm interested in about thinking about some of the energy issues that might be involved, because as we change ionizations in the air and we change the energies around us, we often don't realize the effect that has on us. What we don't see, we don't necessarily pay that much attention to. Mm-hmm. But there's all sorts of energies in our environment that are having some effect on our physiology. And because, again, if you don't have symptoms of it, people don't really consider it. But I was looking at some images of some PET scans. And PET scans are a pretty cool tool that radiologists use to find diseased tissue in the body. And the reason that PET scans work so well is because diseased tissue vibrate at a different frequency than the other tissues of the body. And so we will see those show up with a different contrast or color or density within the tissue. And they're great for finding breast cancer and tumors. PET scans can be a valuable tool for diagnosis. They do, I think there is some controversy about the amount of radiation and things like that are used to evaluate these kinds of things. But it's pretty cool that you can evaluate the body. It kind of takes us back to the Star Trek, the old tricorder, where they run the thing over the body and they find where energy has changed with this energy scanner, and those changes in energy they reprogram and then correct the problem with the reprogramming of the scan. I think, a lot of, I use something that's in the office that's a impulse device, and a lot of the technology that's in that impulse device is related to those types of energy changes. It's using a frequency modified amplitude, and we can change that amplitude and we can change that frequency. We can modify it manually or we can do it automatically, and the automatic setup is set for the spine at different specific areas of the spine based on what we know about those vibrations at their normal. And so you're constantly trying to impulse that part of the spine at a frequency and amplitude that brings it back to its normal amplitude and frequency by vibrating that tissue until it starts to vibrate in harmony with the tool. And there's a piezoelectric sensor within the handle of that tool that allows that to happen. It's pretty complicated stuff, and it's kind of hard to explain to the layperson, but the cool thing is that it's an adjustment to the nervous system and to the spine, which doesn't need to be we don't use manual changes to the spine like I normally do. I mean, I'm a pretty straight principle-based chiropractor, so in my office, the pops and cracks that people are used to hearing that come from an adjusted spine are fairly common, and so sometimes though those are the things that keep people away, because it's like nails on the chalkboard, or some kind of fear that they have, usually a misguided fear, but some fear that they have that's related to that. Those sounds are very benign. Again, we don't know exactly every aspect of that sound and what is happening when an adjustment is properly made. But even if we know some things about it. There's some gases and pressures that are being released, sort of like a pop bottle being opened, and the carbonation of a pop, those bubbles being produced. And there's just the manual position of the two joints that are approximated at a little different angle coming together, and we get that little clap of the joint. The disc itself makes a little bit different noise, and you can always tell when you're making an adjustment if there's some disc involvement based on the way that the joint feels when it moves and the sounds that are made. There's a lot of really cool and interesting things that come into play, though, when we start talking about the weather, because all of those tissues that I just discussed could be related there. And so when somebody is complaining about their joints aching because the weather's coming, it is a fairly accurate predictor of a front coming through. And what I would say to those people is that if that's happening, then you have a condition there of inflammation that's just flying under the radar, and it's time to start taking care of that better. You shouldn't be able to do that, and if you can do that, it's because it's out of control, and it's nearing that point where it's going to be constant. So if you think about that, we're at that point when the weather changes where we start to notice it, because the environmental change has happened, and so our internal environment has take a little bit of time to catch up. And if we're at that verge where it only takes the change in the weather for us to notice the problem, well, that problem isn't going to be long before that problem's here, and it won't take a change in the weather to notice it. It'll just be there all the time. So again, it's definitely past time to start taking care of these problems if you're having them at that point.
Now, what's your approach when somebody comes in? Obviously, the people who say that they can, tell when the weather's changing, are picking it up at different points on their body. Do you treat each spot differently, or tell us about some of those patients and some of the differences?
We evaluate, for new patients who haven't been in, or if it's been a while since you've been in there, we start out by doing a scan, which gives me some objective evaluation of the energy in the system. Where are the hot spots? We do a thermal, infrared thermal that's accurate up to a thousandth of a degree difference from right to left. And we can see along the spine, you've got 33 pairs of nerves there that are controlling the capillary dilation on one side versus the other. And we're basically, you split us down the middle, and one side versus the other side are controlled by different sides of the brain and different sides of the nervous system, but they should be equal and balanced in their function. And as we see big shifts back and forth, then we know that's an area of the spine we should be looking at where there may be some subluxation causing that dysfunction. And also we do an EMG, a surface EMG, which I noticed that Cleveland Clinic is now producing a new kind of EMG, which is very similar to what the EMG that we have over there. And they are having multiple readings in a small area of the spine to evaluate tissue differential, which tissues are involved in the person's pain, because MRIs and X-rays often show damage and tissue issues, but that doesn't necessarily tell us where the pain's coming from, because you can have a terrible looking disc and that's not necessarily symptomatic at all for that patient. It could be coming from the facets, it could be coming from the muscles, ligaments, tissues around it. off this new equipment that's out there has been highly invested in, and I think it's going to be a beneficial piece of equipment. And as I said, it is sort of a takeoff of the technology that we've been using for a long time, which sadly many of the medical people have sort of dismissed this as if it was obsolete. I've even read some articles written by some pretty prominent physicians who were saying, why are we still using this, or why is this still out there, because we've already said this doesn't have any significance. Well, the reason is because it doesn't measure pain. We're not measuring pain, though. We're measuring structural function. We're looking at the somatic nervous tissue function and the balance within that system. And we're looking at the autonomic nervous system function and the balance within that system, both of which fly under the radar of our conscious awareness of whether or not that's balanced or not. You don't feel that the way you or I might think. Pain, which is what we do normally feel, is only, as I said, about 10% of the nervous system tissue is involved in measuring or the conscious awareness of pain. So somehow we have to, if we're going to be treating nervous systems, if we're treating the spine to remove interference to the nervous system, we need some way of measuring that interference. We need to know when the interference is present or when it isn't present. And often we can see somebody who's very symptomatic but doesn't have a lot of interference involved. That's a good patient because you know they're going to respond well. Other patients who are not that symptomatic but have terrible interference in their nervous system, not going to be a very good patient. It's going to be very difficult to get that patient to understand the necessity for them to start taking care of it. And they're going to be a very sick patient, somebody who has a real serious health issues, because those interferences are evidence of imbalance within the energy of that system, very similar to what a PET scan shows us. And we see those imbalances and energy changes within the system that are showing intensities or frequencies that are very different than normal. As we see that, then we know there's something wrong there. Okay, it doesn't tell us exactly what's wrong. It doesn't tell us that it's what the position of the vertebrae is. We have to go on and into palpation and orthopedic neurologic exam to find out exacts. But it definitely gives us an awareness that there's a bigger problem than what the people are considering for themselves, because they're thinking about the pain again.
Now, when somebody comes in and says, okay, it seems like my legs are where I can, predict the weather, and you do the scan, is it 99% of the time, 100% of the time right there in the legs? Or do you find doing the scan that, hey, there's some other spots that there might be some issue spots?
Basically, if somebody has leg pains, for instance, just generalized leg aches from changes in the weather, then they have degenerative disc problems in the lumbar spine, and that's where it's going to show up. Or they have vascular issues in the legs, which is peripheral vascular disease, which is due to smoking or tobacco use, alcohol, those kinds of things that can be related, and other disease processes that are involved. But if it's a vascular condition, then it's often worsened when they're active, and it gets better when they rest. If it's a neurologic or neurogenic condition, then it's going to be much worse when they're at rest, and it's going to get better as they become active. So people who are they get up and they walk a little ways and their legs really start to ache and they have to sit down, and as soon as they sit down the pain goes away, we know that there's a vascular issue there. Probably, more than likely, it's a vascular issue. That same person, if when they're sitting, they're laying in bed, they're restless, their legs are aching and they're jumping around, and then once they get up out of bed and get moving around, it all goes away. That's a neurologic issue, and usually it's related to subluxation in the spine, most likely. Not that the vascular issues can't be related to those same subluxations, because it's about function, and it's about the most important control of that function, whether we're talking vascular or neurologic, is the nervous system. the brain and the nervous system. This is your CPU. This is your central processing unit. All the arteries, veins, constriction, dilation, tissue organization, health of those tissues is completely dependent upon communication between those parts of the body and the brain. So interference, especially long term, can create those kinds of problems too. Degenerative changes within the lumbar spine, for instance, are related, very highly related, to degenerative changes in other parts of the legs or other parts of the vascular system of the legs. Degenerative disc disease at L3, L4, L2, L3, L3, L4, we're almost always going to see knee problems in those patients. L3 goes to the knee is the old saying that we used to have in school when you're learning about the wiring system and how the body is wired. But your third lumbar nerve actually innervates the knee joint. So when we look at knee problems, if that knee is not holding up very well, then what is it in that body that's not allowing it to self-heal and self-regulate to keep it healthy? You're a self-healing, self-regulating organism. There's got to be something interfering with that normal, natural body's ability to heal itself. And when that happens, that's when we start to see those problems become worse. Now, injuries and accidents can often be related to that, and where you actually, like this guy on San Francisco the other day, who the guy rolled up on his knee and twisted it to the side and damaged his knee. He might not have had anything wrong in his low back that was related to that knee. There's definitely not the same correlation in that situation. But for so many of us who just have degenerative joint problems over time that are getting knee replacements, hip replacements, and things like that weren't due to an injury or an accident, it's usually related to that degenerative process that was going on in the spine that they neglected because they just didn't know any better.
Does it make it more difficult for you? I know you like the challenge, but when somebody comes in, because it doesn't seem like it's just a simple, this is what we're going to do. It seems like this is something that they're going to have to commit to, and that you're going to sit with them and kind of develop that game plan of here's how we can get you back in order. Again, as you've always said, these things don't happen overnight. You have to work towards it. Right.
It's a lifetime process, and we have to do that. I mean, the reality of the biggest I guess the biggest misconception that I see out there, and my receptionist was standing at the pharmacy one day, and she's listening to these people at the pharmacy, and they're talking about, this is the people behind the counter, and one of them said, my back's really killing me, I need to go to the chiropractor, and the other one said, well, I wanted to go to the chiropractor, but once you go, they want to keep you forever. And then the pharmacist was like, yeah, my dad he had some problems, and he had to go to the chiropractor, and that once they get you in there, they just don't want to let you go. Well, the reality is, here's the people selling drugs in the pharmacy who got people lined up there picking up their pills, who they're taking for the rest of their life because their body has degenerated to such a point that there's no other thing. They can't get it back on their own, so they have to take these pills on a daily basis, which isn't true, by the way. That's a philosophy. If you choose allopathy as your philosophy, then that's something you can do. Sometimes drugs can be life-saving, but I don't agree with the idea that taking drugs for the rest of your life to manage or maintain physiology is a good idea, because you're going to make the person sick. Drugs make you sick. So taking them for the purpose of getting well is never going to work out very well. Better health through better chemistry has not been a successful experiment thus far, and we've been working real hard at it in our foods and our drugs and everything else. But better health through better chemistry. Look at our health of our nation. We're much less healthy today than we were in the 1950s and 60s, when supposedly we didn't have nearly as much good medicine. There are some life-saving things and I'm not knocking medicine completely. What I'm saying is that we have to look at this. We're very challenged in this country when it comes to our health. And part of the challenge is that we're looking to adding more and more chemicals and removing body parts as the most important and the only real avenue towards health, when really that just makes a person sicker. And until we start to get on board of the idea that getting healthy comes from inside out, not from outside in, and that removing interference to the nervous system through chiropractic, getting onto an exercise program that gets you healthier, eating right, starting to pay attention to what kind of chemicals we're putting into our body, because there are 3 stresses that make us sick. There's emotional stress, physical stress, and chemical stress. That's it. You got 3 things that'll make you sick: emotional stress, physical stress, chemical stress. Continuing to pour more and more chemicals into the body, thinking that's going to be what keeps us healthy or makes us well, is just a backward way of thinking. It isn't working. First of all, we're very sick. It's become the leading cause of preventable accidental death is the properly prescribed medication that Americans are taking. And so there's obviously needs to be a rethinking about the whole system and how we're approaching it. And it is happening. It's happening slowly. I like to watch Dr. Oz, and I like to listen to Dr. Oz because he preaches the same thing that I'm talking about. We really have to look at it as a society, the way we're approaching this. So far, it's been a very lucrative business for the pharmaceutical industry, but it's not been a very beneficial process for the patients that are the supposed beneficiaries of that system. So we have to look at that, and we have to take better time, I think, as healthcare professionals in general, society, parents of children, deciding what we're going to do with those children, when to do it, why to do it, and how to do it, and things that are sort of involved in maybe a bigger, higher approach to a wellness-oriented lifestyle versus waiting until we get sick and then hoping that some magic pill is going to fix us.
Kind of talk about let's take the average. Let's take a healthy individual. All right, they go to the dentist every 6 months. They go to their doctor, every year for their checkup. How often should they come and see you?
I think that an average healthy individual should be going at least once a month to the chiropractor for a checkup and an adjustment. And there's a strong body evidence right now out there that's actually pointing that towards maybe even 2 weeks is a better. People who are getting adjusted every 2 weeks are having better results than those who are getting adjusted once a month. So the results in the lowering of morbidity and mortality in those individuals and the decrease in the cost of their health care overall, there's a couple of good studies that are showing that. There's also the potential for returning back to previous disability scores that go along with post-treatment release of care, and then not sticking with a wellness plan, which would be that monthly maintenance type checkup and correction for problems that might be there. Those who stick to that have a much lower percentage of returning to their previous disability scores than those who don't. And there's a study that I have over on my shelf. I have lots of studies laying around in my adjusting rooms, so that when somebody asks a question, I can pull it out and say, you know what, this is what we know. This is what I've seen that we know of right now about that question. And as I said, one of the biggest and best studies that was done shows that it cuts an individual who sticks with a maintenance care plan of 2 weeks to a month after post care for a problem has a decrease in their health care expenditures by by 2/3. So they're spending 1/3 of what the average cost is. And on top of that, the likelihood of them returning to previous disabilities is also cut by 2/3. So there's also the study that we talked about in here before, that if you go to a medical doctor for a back pain problem, that the likelihood of you, regardless of the condition, it does not matter whether it's a disc problem, a facet problem, a muscle problem, any problem. Take all the problems, the most severe to the least severe, and across the board we look at it. And if you go to an MD or a DO as your first primary entrance into the system, or you go to a chiropractor, the chances of you having surgery by going to the MD or the DO first is 40.7%. The chances of you doing that same, having that surgery for the exact same group of conditions, you know, that's saying that it doesn't matter how severe, 1.5% if they're going to the chiropractor first. Wow. So that's a very significant study. It was a huge study. It's very important. And if you've seen the most recent study on orthopedic surgery, what they did was they did a huge study by the Orthopedic Surgeries Association themselves. They did surgery on knees. They did real surgeries on half of the patients. They did sham surgeries on half of the patients. What they did with half of those patients on these knee surgeries, it was for meniscus. So everybody knows somebody who's had they went to the doctor, they had knee pain. The doctor said, oh, you've got a torn meniscus, we're going to have to repair that. The ones who had the surgery versus the ones who did not, but just had the incision made, no one told them whether they got it or not. And both groups followed through with rehab and physical therapy. No difference.
Wow.
No difference. The ones who had the surgery versus not having the surgery, absolutely no difference. 1 year down the road, 5 years down the road, no difference.
Wow. Well, let's dive into that next week. Dr. Adam Middleton, thanks for your time. We'll see you Tuesday. If folks want to get a hold of him, you can visit him online at middletonchiro.com, middletonchiro.com.